Hi, welcome to Represent NYC. I'm Victoria Bird. I'm the producer of this show. And today we're going to bring you another virtual conversation with one of our city's representatives. Because of the coronavirus pandemic, we are all working from home, doing the best that we can, but we wanted to bring you today City Council Member Mark Levine, who represents the 7th District, Northern Manhattan here in New York City. Hi, Mark, how are you?
Hi, Victoria. I am doing well. I am staying safe at home, and I see you are too.
I am. Now, you did tweet out, so I'm not breaking any confidences, that you contracted COVID-19 and you've recovered after a long period at home, 2 weeks, I think you said. How are you
Yes.
feeling?
Thank you for asking. I am doing so much better. I was pretty bad for about 3 or 4 days with fever and dry cough, typical symptoms of coronavirus. I started to get better though by day 4. It took about 14 days to get back to normal, and that's actually kind of common. But I'll tell you, I was lucky. I didn't need medical care. And that will thankfully be the experience of most of your viewers and most of the public. 80% of people who contract coronavirus are going to be able to recover at home. Now, you have to rest, you have to hydrate. You can take medication for your fever and your cough, over-the-counter medication. And you need to be ready to call your doctor if you don't start improving by day 3 or 4, or if you get worse through difficulty breathing. And it is necessary that you remain at home because the healthcare system, hospitals, emergency rooms, they really have to focus exclusively on those who are most sick, people who are really experiencing respiratory failure. And so the rest of us, if at all possible, we need to stay at home. And the good news is that that's enough. I also didn't pursue a test.
Right.
And I didn't need to pursue a test because we should all assume at this point that there's a chance we have been exposed to coronavirus. And we should assume if we have the symptoms of coronavirus that we do have it. And then we should proceed with all those measures I mentioned to rest at home, to isolate from our family. And testing, like every other medical resource, just needs to be reserved for people who are hospitalized or have other serious complications. And you know what? A positive test result would have told nothing that me or a doctor could have even found useful, because there's no treatment for coronavirus. It's not like the flu where there's Tamiflu. You got to rest at home. So leave testing for those who are extremely sick, and the rest of us rest and heal at home.
You serve on as the chair of the city council for the Committee on Health, right? When do
Yes.
you think, or when is it looking like we're going to reach an apex? Or is that the wrong way to even think about it?
Okay, it's an important question, but it's harder to answer than you might think. And people might be frustrated. Why don't the models agree? Why can't anyone tell us whether we're at the apex? Well, we're having a hard time getting really good data right now. I really feel all the data we have is undercounting the scale of the crisis. Data on confirmed cases is an undercount because we're not testing everybody for reasons I just explained. Data on how many people are in hospitals is an undercount because we're sending people home who are not extremely sick. And therefore, that's not capturing the full scale of this disease. And in fact, we're sending more and more people home, even those who have the equivalent of pneumonia, because we're turning our entire hospital system into an ICU for coronavirus. What about deaths? You'd think that might be the most reliable. Well, it's not. It's also an undercount because significant numbers of New Yorkers are dying at home. I'm sorry, Victoria, to talk about these tough topics, but normally 20 to 25 New Yorkers die a day at home. In this crisis, we're averaging over 200 a day dying at home. We know that most of those deaths should be attributed to coronavirus. There's no other explanation. Most of them, however, are not being registered that way on death certificates. We are undercounting deaths. So how do we know if we're getting to the apex? We have to talk to people in hospitals. They're on the front lines. They're in the war zone. And what they are telling us is it's still brutal. But there is some sign that the number of people entering hospitals, the number of people going onto ventilators, has at least stopped increasing. It's still brutal in there because there are more people coming in every day than are being discharged. But I think we can see that trend and conclude that we are close to leveling off. We have to monitor it day to day. We may, by the time this show is viewed, have already reached that peak. But it doesn't change what we need to do. We still, as New Yorkers, as Manhattanites, have to continue to shelter at home. We have to wear face coverings when we are in public. We have to keep 6-foot distance from everybody when we're in parks. We have to wash our hands obsessively. We have to keep doing that. It is that behavior that has put us on the verge of what we think is a leveling off. Thank you, New Yorkers, for doing that. Don't stop now.
You mentioned people dying, and just the other day, you put out a tweet about what some of the considerations on dealing with people after they've passed away. And it got a lot of heat because you were saying that the city was considering public parks, and headlines started to read, we're going to put deceased in the parks, and it frightened some people, and I wanted to give you an opportunity to clear it up because it's not exactly factual what was being said.
Well, look, our system, our normal systems for handling our deceased loved ones have been overwhelmed. If you, God forbid, have a loved one who has passed away in the last month, you probably know that it's very hard to get service from a funeral home now. It's very hard to get a burial at a cemetery. And so it's fallen on our city's chief medical examiner, which essentially is the city's morgue, to handle this. And they have been furiously working to expand the capacity of our morgues, but they are preparing for the possibility that we're going to need to do temporary interment. And I'll explain what that is. They have clarified in the last day or so that the plan is that such interment will be done on Hart Island, which is an island off the coast of the Bronx. There's already a public cemetery there, which is operating on a low level for generations, but it is ramping up now, and it might need to be even more dramatically ramped up as our city's morgue system needs extra space. This is probably a really scary image, but this kind of temporary interment will be done in a way that is respectful and dignified and orderly and professional, and it will be temporary. After this crisis is over, then families who wish to have a traditional burial will be able to do that. But we do need a system for handling our deceased New Yorkers in the meantime. And our city has had to prepare for the possibility that we will need to do temporary interment in a place like Hart Island. I keep saying if, because this could still be avoided if the number of deaths drops dramatically, but we have to be prepared as a city and as city government for every possibility. And that's why I and others have been talking about this in recent days.
I also want to talk about a tweet that you sent out this morning showing the New York City Health Report and how this COVID-19 is hitting certain racial communities. It's 22% Latin, Hispanic and Latin, 19.8% Black, and then I think it's like 10% white and 8% Asian American. And what do you think that says, if anything?
Well, it says a lot. It's painful. We have to confront it. And that's why we have been agitating for a long time for the city to publish this data. It's really important that they have now done that. They have published breakdown of deaths from coronavirus by race. And I think it confirms what a lot of us were suspecting and experiencing when you look at the neighborhoods that have been hit hardest in New York City, the hospitals in those neighborhoods that are overflowing, and the anecdotal evidence. The very painful truth is that this pandemic is exacerbating existing inequalities in New York City and reflecting those inequalities in housing, inequalities in employment, and most of all, inequalities in healthcare, racism in medical institutions, unequal access to healthy food. And all of that has contributed to unequal health outcomes in New York City for years, for decades, in rates of diabetes and heart disease and stroke and hypertension. All of that makes a person more vulnerable to contract COVID-19. And if they do contract it, it makes them more likely to get a very serious case that could lead to fatality. And we've been agitating for days, for New York City, weeks, to publish this. And it reflects a true injustice in the city that it's high time we confront.
And it's interesting because it's not even probably all the information, because if there are 10 people and 5 aren't reporting, this information is not even the full numbers.
This is not the complete picture yet. We urged the city to start publishing while we were building the complete picture because we didn't want to wait another week or month or longer. So I think they were right to put it out there, and they were clear about the limitations of this data. But what we already see paints a stark picture of inequality, and we need more information.
And also, I think you actually mentioned to me earlier when we were talking offline that it reflects how African Americans and Hispanics might be the ones that are staying on the front lines in the hospitals, at the pharmacies, at the grocery stores.
Yeah. Look, the ability to shelter at home and to telecommute is a luxury. It's not a luxury everybody in this city has. The people on the front line in essential sectors are disproportionately people of color. And these are the people who are in healthcare, in mass transit, in supermarkets, pharmacies, first responders like EMS workers, and people in laundromats. They are putting themselves at risk for us to keep the essential functions of the city running. And tragically, it's part of the reason why New Yorkers of color are now confronting this pandemic at disproportionately high levels. I mentioned housing early as well. And one thing we've known about coronavirus from day one is that it spreads in tight circumstances like crowded housing conditions. And again, who's likely to live in crowded housing conditions? It is low-income New Yorkers and New Yorkers of color.
So what do you think the city needs the most right now?
Don't think for a second that our hospitals are still not in crisis. They need more equipment. They need more supplies, especially personal protective gear for workers. No hospital, no nursing home has anything more than a few days buffer on those supplies if they're lucky. No hospital has any more than a few days supply left of ventilators if they're lucky. So we need the federal government to come to our aid and to mobilize production and distribution nationally. We had the first coronavirus case January 20th in America. That was the latest date by which the federal government should have ramped up this production nationally. We're in April now, and we're still fighting for this. It's inexcusable. The failure to ramp up production of equipment and supplies and get it to places like New York City is going to go down in history as an even more epic failure than the failure to get testing capacity rolled out. And that was epic.
Would you say it has something to do with our mayor and then even a larger scale, our governor's relationship with the president of the United States?
That shouldn't matter right now. We are in a health emergency, equivalent of wartime. All that matters is saving lives. It shouldn't matter whether you're in a red state or a blue state, or whether your governor or mayor is a Democrat or Republican. That's irrelevant. We have to save lives. And you know what state has gotten everything it's asked for? Times 2, times 3, Florida. It's outrageous. Yeah. Send the supplies where it's needed. It's irrelevant what the party affiliation of the people or the elected leadership is. We have a medical crisis, and it is disgraceful that politics would determine where one mask or one glove or one ventilator is sent. This is no way to run a national emergency, and it has put New Yorkers and Manhattanites at risk, and we are not out of this crisis yet.
I want to get your thoughts on the concept of rent forgiveness. I mean, I know that's not a city level thing, but I mean,
Right.
it's something that we've been hearing about and people have been clamoring for as they've lost their jobs, and now April rents came due, and the governor gave us a stay of evictions, but I mean, I don't really know how that's going to help if you've got a $2,000 rent due and you've got no job. What
Right.
what what are you hearing as far as like any movement at all on any kind of anything?
Well, this is, as you said, these are laws that are established at the state level,
Right.
and we have amazing allies from all over Manhattan who are fighting really hard for tenants right now in the Assembly and the Senate. I'll tell you what we've done and what needs to be done still. We have avoided the immediate emergency of ongoing evictions and housing court actions. So there has been a 90-day moratorium on evictions, and actually housing courts not currently operating. And that applies both to residential tenants, but also commercial tenants, stores, etc. Why isn't that enough? Because rent is still accruing. And so if you lost your income, and sure, you can go 90 days and you're not going to be evicted, but then we get to the 90-day mark, it's in mid-June, and all of a sudden you're going to owe whatever it is, $5,000 of back rent. You weren't receiving income over those 90 days. You don't have the ability to pay the back rent, and therefore you could be vulnerable to an eviction the next day. And
Right.
so all we've really done at the moment is push this off to June. And so we have to have a way to actually to cancel the rent for people who are low income, for people who are not able to pay.
Let me ask you a question. There is something called in the New York City called a one-shot deal. Could they implement something in that area where the one-shot deal could be expanded to cover this sort of pandemic
Yes, but
contingency?
yes, but you know what? The city can't pay everyone's rent. We're going to have to
Right.
ask the landlords to take a hit.
Yeah.
Landlords are going to have to take a hit. Now, landlords are also in the legislation that's proposed in Albany going to get some help by not having to pay their mortgages during this period, and I believe by not having mortgage interest accrued during this period. And so banks are going to have to take a hit. But you know what? Banks can get zero interest money from the Fed right now. The banks are going to be okay.
Right.
The most vulnerable in this entire scenario is not the banks, it's not landlords, it's tenants. And the first thing we have to do is prevent what could be an unprecedented wave of evictions as soon as the 90-day moratorium is up. The only way you can do that is by canceling the rent for those who can't pay during what is an unprecedented emergency. There are good bills in the Assembly and in the Senate that would do that, and I'm hopeful that they'll be passed. And I'm cheering on our great allies in Albany who are fighting for that.
So I want to give people a way to reach out to you. If they're in your district and they need to speak to you, they need help, they need advice. I
Yeah,
know your physical office, I used to pass it every day on my way
right.
to work. It's
Yeah,
closed right now, but how can they
yeah.
get in touch with you?
We of course we closed our physical office because it's a safety issue, but our landline number still works. It rolls over to people's cell phones, and during business hours, you can call 212-928-6814. We're also on email 24/7, and that is just District 7, like the number 7, District 7 at council.nyc.gov. And we're very active on Facebook and on Twitter. You can follow me at Mark Levine NYC. I'm very active on Twitter. We have staff who are responding to questions on Facebook regularly. And we're also doing a series of live Q&A chats via Zoom, and we're alternating English to Spanish approximately once a week. We do one of each, and folks who are connected to us can join in, and you can ask your questions in live time about medical issues or hospital issues or unemployment assistance or assistance for small businesses, whatever you need help on. We are here to support you.
Mark, thank you so much for joining me and talking to me about what's been happening. And again, I'm so glad you're feeling better. And
Thank
I
you.
look forward to seeing you in the studio.
Me too. In the meantime, stay safe, and I hope all your viewers continue to be healthy, to remain at home, and I wish everyone all the best.
We're going to be joined now with Assemblymember Rodriguez, who represents the 68th district here in New York City. That's East Harlem, that's Randall's Island, that's Ward's Island. Welcome.
Hi, it's really happy to be here with you.
So I want to talk first about your district, which there was a recent report that was released, or the data was released from New York City about who has been the hardest hit racially, has been the hardest hit. And Blacks and Latinos have been much higher as far as numbers go, hit with COVID-19 and the effects of COVID-19. Can you talk a little bit about that and how it's affected your district?
Yeah, I think for us, we've been a little bit lucky in terms of Manhattan numbers in general not being as dramatic in terms of the number of infections as well as fatalities. So fortunately, Manhattan is doing a little bit better. But when you look at the pockets within Manhattan, including communities like East Harlem, as well as some of the other low-income minority communities, we do tend to have a disproportionate number. I think a lot of our numbers are representative of kind of the bigger picture of Manhattan, because we do have one of the major hospital institutions, Mount Sinai. So the numbers that they have of people that they've treated have not been specific just to East Harlem, so it's hard to kind of differentiate all that data. But I would look at something like a Metropolitan Hospital, which has had about close to 200 folks who have been treated, and I think close to 30 people have died. But that's part of a bigger problem that we're seeing much more exaggerated in other communities, where we know that they had health disparities already: asthma, diabetes, respiratory issues, heart disease, and then that just gets exacerbated by the things like COVID-19, plus the way that we live. In some place like East Harlem, we hold our breath because collectively we have more public housing than any other location. We know the density of that housing as well as some of the density of our Michelamas. And also remembering that so many of our essential workers, police, fire, nurses, live in public housing as well. So many of the folks who have to leave their job and or can't afford to stay home and still have to do something and end up continuing to work in some way, shape, or form. All those things kind of contribute to the issues that we see. So we're thankful that the numbers have not been as bad as they could have been. We're grateful that the numbers have somewhat plateaued in terms of both the number of hospitalizations, but we're coming off of a week that's been pretty challenging in terms of the number of people who have died. And we are hopeful that we are plateauing and that we're coming to the other side of the hill, and that's what some of the data is starting to represent. But I think as we dig deeper and see who this impacts more, it's certainly Black and Latinos, and it's certainly the low-income working class communities that are feeling the brunt.
Question about the hospitals. How are they managing the crisis in your district, and how is the state working to make it easier and protect, with protective gear and things like that, and ventilators?
Yeah, so in the beginning, we know that was definitely rocky in terms of making sure that they had enough of the numbers of PPE equipment that they needed. Mount Sinai was, I think, able to really ramp up in many different ways that have been reported to make sure that they had a baseline. But even with that, some of the precautions and advice that were given by the state in terms of how to treat COVID patients, and using one set if you're in the COVID ward, but only changing when you deal with non-COVID folks instead of every single patient, certainly shows that there has been stress on the use of PPE equipment. But the state has been working very hard to make sure that each hospital has at least 3 days minimum of PPE equipment on hand for all cases. And in the event that they start to run low, they give 24-hour notice and they're able to get re-upped in terms of PPE
Oh,
equipment.
good.
Yep, and so we've been lucky. Both Metropolitan Hospital and Mount Sinai have been okay in terms of being able to manage their baseline in terms of cases. I think we were all concerned that if we had a major surge beyond kind of where we are now in terms of deaths and hospitalizations, we didn't have enough ventilators, we wouldn't have enough beds. There were talks about the tent that Mount Sinai built in Central Park. All of those were very real measures that would have been necessary if the numbers kept going up. But I think right now the system is holding, the safety net is holding, and it's really just because of the efforts of our doctors and our nurses and our folks who are really burning, the candle on both ends to just continue to treat people in some really, really hard conditions. So, I just want to say thank you to all of them for the work that they're doing. And, we're grateful. We have seen some other issues outside of the hospitals. Thankfully, the hospitals have done okay. The other places that have done worse are somewhat of our nursing homes, places like Terrence Cardinal Cook and the former Father Lot residents, an assisted living program. Those are the folks that have and continue to see a lot of COVID cases, and then also we've seen fatalities, and they have. We have had to rush in and send additional PPE equipment there because of the volume and the sensitivity of the patients that are in those areas, as well as Randall's and Ward's Island. We have a forensic psych facility, Kirby, that also needed additional PPE equipment. So we're doing our best to fill those gaps because from a priority perspective, hospitals came first. But now we're looking at how do we take care of some of the other folks that really needed support. And thankfully, we've been able to get them supplies and push through the governor and the state to make sure that those folks don't get forgotten. And that's been, they've been doing better.
Talking about supplies, I mean, food is an issue. I know the supermarkets where I am are missing certain items, flour, strange things and very basic things. How are you guys dealing with access to food?
Food has been a dramatic issue in our community. As a low-income working class community, we have many people who have lost their jobs or who are seniors and who are now homebound and concerned about going to the supermarkets and figuring out how to be able to do that, in this new time. One of the first things that we tried to set up was senior hours at a number of different supermarkets, but everyone is not doing this. And all our seniors are not able to either go out, utilize internet technology and get windows for Fresh Direct and and do those things. So it really comes down to them being able to get basic access to food. We have a number of really fantastic local organizations that have been really ramping up to provide meals. I just want to acknowledge the work that they've been doing from the beginning. So La Fonda Boricua and the World Central Kitchen have been boots on the ground, since the beginning. They're doing at least 2,000 meals a day. We've been working with them to get them additional delivery capacity to be able to ramp that up to maybe 4,000 to 6,000 meals a day. And PSA 5, our police precinct, has been helping us to do deliveries by literally taking these meals and dropping them to TA presidents in NYCHA developments and other housing developments where the TA leaders on the ground, including some of our district leaders, are helping to distribute much of that food to seniors specifically in their developments. So many restaurants have come together to try and figure out how can they be useful, when they're not able to be open, but still have kitchens and capacities to be able to do that. So that's been really a bright spot in terms of how we take care of our community. Also important is the senior center network. The city has kind of taken over that senior center network and are providing meals delivery as well to seniors who previously, are really seniors and anyone who calls and is experiencing food insecurity. So it's important that that one is being managed through the 311 process. That's how they're providing senior meals. And then schools. We're going to put up somewhere a list of all the schools in the district. They're still doing 3 meals a day. Students and families at 7:30 to 11 can pick up their meals. It's grab and go. So it's not going to be hot meals, but we're also doing any adults after 11:30 to 1:30 who's having food issues or needs meals can also come to the schools to be able to get meals. So
Yeah.
those are really important ways that we've been able to really try to connect people to resources.
I want to really thank you so much for taking the time to meet with me virtually and talk about what's going on. But before we say goodbye, I want you to talk about the census.
Yes.
I did it. I did a segment on it with somebody from Citizens United, and I even was dilly-dallying with going to that internet. And my mom, for example, doesn't have a computer.
Yeah.
So there are a lot of people that are sort of in the dark about this. Talk to us a little bit about that.
We get so overwhelmed with our circumstances that something like census, that we had every intention of doing and mailing out, just, kind of falls by the wayside. But it's up to us to kind of think about how to pick it up. In a situation like this, that may be one of the only things we can do that kind of, pushes government to remember us, to recognize that we're still here, to help us get counted so that we get the resources that we need, especially, resources that during a situation like now we couldn't have foreseen, but may get determined strictly on people. The number of people that we have may determine, how much money we get in terms of Medicaid dollars to help support us during COVID, how many cases. It just might be based on the number of people and cases. And that's where numbers and data like the census really matters. And, in all honesty, our numbers are low. We're not getting the response rate that we had hoped and projected. I think we're at like 35% response rate so far. And it's going to be even more important because we don't know if we're going to be able to knock on your door like normal. We don't know yet if the process will get extended. There's some discussion about that. But the easiest thing that we can do is either mail back our form or go online or make a phone call. The other thing that we can do to be responsive in the crisis, in addition to checking on our neighbors, is filling out the census. So you can even skip your taxes, just do the census.
Thank you so much for joining us today. I appreciate your time.
Thank you.
Good to see you.
Thanks.
Stay
well.
safe.
Be safe.
Welcome back to Represent NYC on the Manhattan Neighborhood Network. I'm Victoria Burt, and I wanted to talk today about a group of people that are severely affected by this COVID outbreak, the homeless, and how we can protect the homeless, how we can help organizations that are working with the homeless. And joining me today is Ann Shaloff, and she's the executive director of NCS here in New York City. And the Neighborhood Coalition for Shelter provides New Yorkers who are homeless and at risk of homelessness with a home and a community and access to services. Hi, Ann, how are you?
I'm well. How are you?
I'm well.
Good.
Tell me a little bit about how the homeless are being affected by this pandemic.
Well, they are particularly vulnerable to the pandemic. I mean, if you think about it, people who are homeless are not able to comply with the most basic guidance that we're being given, which is to stay home. So for somebody, particularly somebody who is homeless on the street, they can't go home. They can't comply with the precautions that are being recommended around hygiene. Wash your hands. Many of the places they might have gone to wash their hands, like a park restroom or a library, those are closed to them. Many of the resources that people both on the street or living in a shelter might have access, things like food resources, are drying up, are changing. So people who are homeless are left particularly vulnerable. And some of them, many of them, have underlying conditions, either a result of or a cause of their homelessness, that also make them particularly susceptible. So they're facing a very great challenge right now.
So it's difficult for them to maintain social distancing, and they are susceptible to infections because of underlying conditions. So how are the advocates for the homeless and the organizations like yours working to remedy this? I mean, how is that even possible?
So it's a very great challenge. I mean, if you think about a shelter situation, particularly a dormitory style shelter, you're right, social distancing is virtually impossible. And providers are doing what they can as far as trying to space beds, to have people sleep toe to toe, to, basically close down common areas. In our residences, one of which is a single room occupancy residence, where there are small units and then shared bathrooms and a shared kitchen, we've had to close all of the common areas, cancel all kinds of group activities, and really look to our clients to stay within their individual units. We've done a lot to try to educate people about how you prevent COVID, how it's transmitted, what they can do to protect themselves. But it's a very great challenge if people are living in close quarters and sharing facilities. Now the city has begun to bring online what they're calling isolation hotels. And that is beginning to offer a resource for us where we can send somebody who is ill with the COVID infection, and they can be there and remain in isolation there while they recover until they're able to return and no longer be contagious.
Now, what about food? I mean, I imagine that donations and churches and organizations that were providing food to places like NCS or other shelters are experiencing sort of that source is drying out. Is that true?
A good number of sources have dried up. Many of the community meals that faith organizations offered have stopped operating. At the same time now, there are other organizations that are stepping in. We are sort of scrambling to provide meals and get donations from different sources. Because we do find, of course, that we have to provide meals for clients that we never had to feed before, since they are advised to stay at home. And many of our tenants are over 60 or even over 70 and 80, so that they really shouldn't be out in the community. We are sort of working all of our contacts to try to get meals donated, and then we're going around trying to pick them up from different places. But the city also is starting to put in place some more centralized resources that we hope will be able to eventually provide meals on a regular basis. Right now, those are not fully operational and there are some glitches with them, but I think we're starting to adapt to this new reality of how services are offered.
I know that New York City is also offering 3 meals a day to anybody who needs a meal, and you can go to the New York City website and find the locations. I think there are over 400 locations in New York that are offering 3 meals. It doesn't matter, you don't have to qualify yourself. You just show up and you get food, which I think is really great. Tell me about the concept. We talked a little earlier, and you told me about the concept of the new homeless that will emerge. Tell us about that.
Right. So when we speak about the impact of the COVID virus right now on the homeless, I think all of us have in mind people who were homeless at the start of the pandemic. What we don't know yet is what the longer term impact of this pandemic will be. We're certainly seeing economic impacts. We're certainly looking at a severe recession. Many people have lost their jobs. Right now, there are protections in place. There is a moratorium on evictions, for example. But looking down the road, it's hard to know and difficult to think about how many people could potentially be rendered homeless by the current situation and the repercussions. And then I've also heard anecdotally about people in the very short term losing their housing because of the COVID virus. And there I'm speaking about people who are homeless but may not be counted as homeless, people who are living doubled up or couch surfing, and they're not figuring in the statistics on the number of homeless because they're not in the shelter system. But I've been hearing of people basically being kicked out because nobody wants them to stay if they're COVID positive.
Can people donate? I know that people can donate funds to shelter systems and to NCS, but can they donate food? Can they donate clothes? Can they, what else can they do? What can they, how can they help?
So there absolutely still is room for donations and for volunteers. Many of the traditional ways that people would donate or volunteer may be on hold right now. But for example, we absolutely can use food donations, and we can use volunteers to help us collect donations. You know, if we get a phone call from a church that they have some leftover dinners, we can use a volunteer to go get those for us. We absolutely can use food. On clothing, we're a little bit wary right now because, you know, we don't want to be bringing in a lot of things from the outside. You know, if we don't know who last wore them and are they clean and all of that. But certainly donations of food, donations of time, and absolutely donations of money. Organizations like mine are now stepping up and providing services that we've never been tasked with before. And we are all strapped and worried about the longer term outlook, given, you know, the impact that this whole situation will have on city and state budgets and private donations. So, you know, absolutely we can use funds as well.
And I imagine that annual fundraisers have to be changed completely. So it'll, the dynamic of that will change, and being able to stay in business, essentially, to help others. Now, I know that you also work with teens and young adults, and you know, I imagine that there, you know, there is a large number of young adults and teens and children that are homeless in this city, and are they grasping the severity of this pandemic and following the rules? Are you seeing a different sort of relationship to self-care than, say, the older or more mature people?
They're young adults, so some of them are certainly grasping the severity and are complying with the guidance that we've been giving, and our staff has been working very hard to make sure that our young adult tenants understand how they can protect themselves and what the risk is. But, you know, they're young adults. They think they're immortal, and a lot of them are continuing with the behavior that they always did. We've banned visitors to our residents, but that doesn't mean that everybody is complying. I know we try to bring home the severity of the situation by saying to them, well, you know, you may be immortal, but if you visit your grandmother or your godmother or somebody like that, you may be bringing something to them that you don't want to introduce into their environment. So, you know, we hope that that kind of explanation will carry some weight, but, you know, they're behaving like any young adults do.
Well, I want to thank you so much for taking the time to speak to us. I really appreciate your time, so thank you, and stay safe.
Thank you. You too.
Thanks so much. We'll be right back. I wanted to touch on today a topic that I think is vitally important to talk about, and it's domestic violence and the danger that comes with being on pause and in your home 24/7 or more than normal if you're experiencing some form of domestic violence. Joining me now from Safe Horizon is Maureen Curtis, and Maureen is the Vice President of Criminal Justice Programs for that organization. Hi, Maureen, how are you?
Good, how are you? Thanks for inviting me.
Of course. Tell me, if you can, just what Safe Horizons is and how it works.
Safe Horizon is the largest victim services agency in the country. We work with all victims of crime. So whether you're a victim of domestic violence, sexual assault, trafficking, or a victim of robbery, stranger assault, burglary, you can come to any one of our many programs and receive assistance that includes client-centered trauma-informed services. We help people where they're at. We do safety assessments and safety planning that includes talking about options and services that may be available for them. We work in courts, in police precincts, in the community. We run the 3 hotlines, a domestic violence hotline, a rape sexual assault hotline, and a crime victim hotline. We have about 50% of the New York City domestic violence shelter beds are run by Safer Aizen. We run child advocacy centers. We work with homeless runaway youth. And then we have specific programs that work with specific populations, such as our domestic violence law project, our immigration law project, our anti-trafficking program.
So during this time of the coronavirus and people are in quarantine, this is obviously a more dangerous time for somebody who is being victimized in their home, correct?
Yes, yes, definitely. I mean, one of the tactics that abusers often use is isolation. They isolate a person from family, friends, coworkers. So now to be told to stay home where you're isolated with that person can definitely lead to whether it be escalated physical violence or even emotional or psychological violence.
What kind of changes in the 911 calls have you seen? Is there been an increase or a decrease? And is the response time changing because of what we're experiencing now in New York?
The police are still responding to 911 calls. We have heard that there has been a slight drop in 911 calls for domestic violence, but the police are still responding and helping victims who may feel the need to call 911. Our shelters are still open and our hotline is still operating 24 hours, 7 days a week. We've seen a slight drop in calls to our hotline, not significant, but there has been a slight drop. And that's not surprising because I think that some people may be afraid or not able to call 911 or to call the hotline to speak with somebody for assistance because they're now at home 24/7 with the person who is abusive towards them.
Am I incorrect in saying that they would make that call when they were alone?
Possibly, yes. Of course, a 911 call would come over when the person was there because a 911 call is when they're being physically threatened.
Right.
And they feel their life is in danger, so they call 911. But calling the hotline, yes, most people would call when they're on their own, when it's a safe time for them to speak with an advocate and talk about what options may be available for them. And the person could be calling because they're in need of shelter, but sometimes survivors just call just to talk, just to explore options, see what resources are out there, or just to talk about what's happening to them so that they have somebody who's going to listen to them in a supportive way and in a non-judgmental way.
Are there beds available now for people?
Yes, there are beds available. So we run 9 shelters, about 750 beds in those shelters citywide. And there are other agencies that also operate domestic violence shelters in New York City. And they're still accepting survivors and their children into shelter.
And you mentioned phone calls, right? So is there another way to reach you guys? Can people text? Can people write emails?
So people can reach us via email. They can go on our website and be connected to what's called a safe chat, where they can chat with a live advocate, and that might be safer for them. So maybe they can go into another room where they can chat with that person instead of talking because they're worried about the abuser hearing them on the phone. So that's another way that they can be assisted. They can go to some of the websites, whether it's our website, whether it's the mayor's office website, where they can find information about other numbers that they can call. So they can call and receive assistance about getting an order of protection. We have programs where we work with police officers. We have staff assigned to police precincts throughout New York City. And even though we're not actually physically in the precincts at this moment, we're in constant contact with the police officers so that survivors who may have called 911 are getting referred to us so that our advocates can follow up and outreach with that person to provide additional assistance for them.
What kind of concerns should they have about the COVID virus and going into a shelter? Or will they experience any kind of pushback from hospitals if they need to call or go to the hospital?
Survivors make decisions all the time that weighs their risk about what things what next steps that they want to take in order to keep themselves safe. So a person may decide that at this time, going into shelter is the best option for them, even though they may be concerned about going into a shared living space, but they're more concerned about the threat of physical violence. Similarly, calling a hospital or going into a hospital, a person, even COVID violence may make a decision as to whether or not their injuries require them to go into a hospital. These are decisions and considerations that survivors make even before the COVID virus. And there's no doubt that with the fear of being exposed to somebody who has the virus, that is another risk that the survivor is going to consider in deciding what next steps they want to take.
What if you have children? Are there still spaces that someone with children can go currently?
Certainly, yep. Our shelters, as many of the shelters in New York City, accept survivors with their children. And if a person feels that they're in need to go into a shelter, they can call the hotline. It's 24 hours, 7 days a week, and the advocates will do an assessment to determine the person's need and then check the shelters in the city to see if there's space available. And if there wasn't space available, the advocates are also able to look outside of New York City. If the person says, well, I'm okay going to New Jersey, or I'm okay going to Westchester or Rockland County, we have connections with other providers and other hotlines in other jurisdictions that we can check as well.
Now, have there been any changes to how the process works because people are working remotely, people are working from home? As far as working with your organization, like let's say if they need to get something like an order of protection, how has that changed, or has it?
That has changed where now all of the staff. So I oversee the criminal justice programs, and these are staff who work in family courts, criminal courts, police precincts, and family justice centers citywide, and all of the staff that work in these programs are now working remotely. So to your question about an order of protection, now that the courts are all operating remotely, a person who wants to petition for an order of protection can do it remotely. They can even do it on their own if they want, by calling the number that's available for the court. But it can be an onerous process. So our advocates who this is what they do mainly in the family court program day to day, where they help a person petition online for an order of protection. They are now doing it remotely. So they are working with any survivor who is interested in petitioning for an order of protection. So a person calls at 9 o'clock, and more than likely by 11 o'clock, they are going to be meeting with a judge remotely and getting a temporary order of protection. And in addition to helping them do that, we can also safety plan with that person around what it means to now have that order of protection. How is it going to be served, and what's going to happen when that person is served, and to talk about how they're going to keep themselves safe, and also if they need to enforce it, what it means to enforce that order of protection.
So I want to touch on something that I think is interesting, that we shouldn't just think about this danger or this time as dangerous, that it's going to end when the quarantine, as it were, that we're no longer on pause, when that ends. This whole thing, and the ripple effect that it will have, you think that we will see an increase in domestic violence in general?
I think that we're going to see, yes, because I think that while loss of job, other stresses in a person's life does not cause domestic violence, but it definitely has an impact and can exacerbate violence in the home. And I think that sadly, we're going to see a real hit to our economy. We're already seeing, businesses shut down, people losing their jobs. And that's going to have an impact on relationships. And if there is violence or any type of coercive control in a relationship, there's no doubt that could, increase the potential violence in the home. I think that, one of the things that we talk about is, in terms of safety planning, is not just safety planning in the moment, and not just safety planning around leaving, but safety planning when you think that something may happen, whether it's a physical incident or a emotional or psychological incident. What are some things that either you have done to protect yourself and protect your children that you can continue to do to protect yourself and protect your children? And the other thing, the third tip is so important for survivors to know that they may be isolated, they may be at home with somebody who is abusive to them, whether it's physically, emotionally, sexually, or psychologically, but help is available. And even though many of our programs, as are other programs in the city, are operating remotely, we are still here to help. Our hotline is still 24 hours, 7 days a week. Our shelters are still accepting survivors and their children. And the services that so many survivors turn to, the police, they're still responding to 911 calls. Getting an order of protection, we still can help a person get an order of protection, get it served remotely. So all of that is still happening, and it's really important that survivors know that.
And you also provide services in Spanish, correct? Do you have any other languages?
That's correct. Yes, we have staff that speak a variety of languages in our precinct program, the Crime Victim Assistance Program, and our Criminal Justice Program. We have staff that speak up to 17 different languages. So first, we're going to try to connect them to a person that speaks their language. But if we're not able to, we use language lines so that we can communicate with them in their own language.
I want to just finish with this. Can people donate to Safe Horizons?
Yes, people can definitely donate to Safe Horizon. Whoever donates, the money goes to, so many great programs that help survivors and other victims of crime. And I think that now more than ever, Safe Horizon and programs like ours are going to need money to help survivors. And that help could be, giving them a Target card so they're able to go out shopping. If they come into court and they have no money for themselves or their children, food vouchers so that they can go to a local place and have something to eat while they're waiting to go back to court in the afternoon. So even little things like that are so critical to help survivors.
Wonderful. Thank you so much. I really appreciate
Very
you
welcome.
taking the time to do this. I mean, just, I immediately thought when we all went into quarantine that there is going to be this group of people that are going to even be in more danger because they're trapped in their own house, and that can be the most terrifying place. Mm-hmm. So I really appreciate you speaking with us and letting us know that there's still help, and they're not alone.
Yes, and thank you for inviting me, and that's definitely the main message. You're not alone, and help is still available.
Thank you so much, Maureen.
Thank you. Thank you.